Access to care is critical when it comes to meeting youth mental health needs. My name is Emily Kerr, and I'm the founder and executive director of Charleston Hope. Charleston Hope is a 501c3 nonprofit organization based in Charleston, South Carolina, and we work to increase access to mental and behavioral health programs for students who are living at or below the federal poverty line. Charleston Hope was created in 2011. My sister, she was a first-year teacher, and I grew up wanting to be a teacher my entire life, and so watching her step into her first year of teaching was really exciting for me to witness and to watch her. And over the course of that year, to me, the needs of her students just became more and more evident, and the lack of support and resources that she had from the school or others was just so evident. And so I stepped in and wanted to help her and help her students. And what started Charleston Hope as providing Christmas presents during the holiday season and food during the holiday break has really evolved over the last decade and beyond. And we took an approach to really listen to the needs of our families and our students and the teachers that were teaching in these schools, serving students living at or below the federal poverty line. We've just evolved our programs, and now we get to focus on providing mental and behavioral health programs in schools and in communities. And we believe that if we can start early and meet a child's mental health needs, they are going to have the tools they need to feel equipped to thrive now and later on in life.
Hope is more than a feeling. Hope is what we see every single week in our programs when a student's eyes light up as they take steps towards growth and healing. Hope is the very thing that unites a community when people show up, even when it's hard. Hope doesn't solve our problems, but it gives us and students the courage to face them. My name is Tevin Sims, and I am the advancement director. The community can support Charleston Hope by showing up. The mission that we have is greater than any one individual, and if we're going to continue to increase access to mental and behavioral health support in our schools for students, it's going to take a community.
Coming out of COVID, it was very evident the inequities that youth were facing, especially for minority kids, to get the care that they need when it came to their mental health. In South Carolina, we are ranked 47th in access to youth mental health care. And in our state, 43 out of 46 counties are considered to be in a clinician shortage. Access needs to come and meet students and families where they're at. In South Carolina, suicide is the third leading cause of death for youth ages 10 through 14, which is a 55% increase since 2016. The need is only growing for our youth to receive mental health care and access to care. Kids should be outside, they should be playing with their friends and enjoying learning, but instead, many of them are silently suffering.
The mission of Charleston Hope is truly transformational to the students and families that we serve by increasing the access to mental health care. Mental health is one of the most important things that someone can do for their overall well-being. And I have experienced many years of therapy that has shaped every aspect of my life. My name is Kendall Bigga, and I'm the operations director at Charleston Hope. Hope means meeting our students, families, and communities where they're at and ensuring that they know that the circumstances that they're experiencing do not determine the potential for their future.
There's a tremendous gap in mental health for pediatrics. What we're finding is that there's a ratio of 1 to approximately 1,300 in South Carolina, and there's no real designation for pediatric mental health in South Carolina. My name is Dr. Janelle Perkins. I'm a licensed marriage and family therapist and board member for Charleston Hope. I have been in the mental health field for more than 25 years. I've worked with military, first responders, and with communities, helping families become their best selves. Charleston Hope's two programs that are most important are the school-based counseling, which is one-to-one for the students, as well as the enrichment programs in Step In, which allow us to have an opportunity to help students with their self-esteem. The internship program at Charleston Hope is one that is most dear to my heart. We must develop new counselors that have a greater degree of cultural humility and cultural competence. With the rise in anxiety and depression amongst young people, we really need to ensure that we have mental health programming that's available within the school systems. We have to take it to the places where they live.